I think we have missed two YouTube live. This is there was a gap of two YouTube live because I was not there. I was in a conference and workshop in Germany, so I could not do the live. Now, from where we left, few questions were unanswered before that because there were a lot of questions and I could not answer. Whatever questions I remember which I could not answer, I'll try to first answer that, and then we'll go to the today's question. Now there was a question where where somebody had asked me that, sir, whenever the patient does slight exercise or whenever the patient does slight something, some exercise, some exertion, minimal also, the patient starts getting cough. So normally, what, in cough you normally ask, how is the expectoration, how is the color of expectoration, whether the cough is dry, whether the cough is wet. It depends upon what is the most defining symptom of that patient's personality, the most defining symptom of that patient's personality. In this case, you have asked me the question, if there is a small exercise, if there is little exertion and the patient starts getting cough, you must think of there are a lot of remedies. The first remedy that you should think about is Oxytropus lamberti, Oxytropis lamberti. I have got fantastic results whenever the patient comes and tells you that even in small exercise, the patient starts getting cough. Good afternoon, Dr. Shinobi. Yeah. So let us go forward. Hello sir, mother के nails पर light brown lines है, उनके complexion dark है, is it normal or not? Yeah, if there is no pathology involved and if there is only discoloration of the nails which are brown, then you don't need a medicine. You can take the whole case and depends on that case whether you have to give medicines or not. But as such, if there are no indications, then you can wait. Okay, any other questions? Or we can start with the, I can start with other questions. Now see, okay, is it okay, Isha? Now see, nails may there are a lot of indications. You sometimes get a lot of things on what stuff, nails corrugated, nails are blue lines, yellow lines. Symptomatic, if it is not there, then you can wait. Yeah, Dr. Aha, hello and salams. Great to see you after a fabulous time. Same here. Thank you so much. Thank you so much. Thank you, Dr. Vishaka. Yeah, Dr. Aha, you can go ahead with the case. So I had before Dr. Aha puts up the case, I'll just tell you something about cough all. Now there was one more. Sir, red mole ki dawai batai. No, Dr. Kumar, I have still not cured a case where the red mole was there and after the medicine the red mole has got cured. So I have not had a case. Please take about your potency research. Yeah, Dr. Vishaka, that's a very long, it's a very long potency which I have made. I have given the books in Germany, which I have released. So in maybe coming webinars or coming Zoom, I'll discuss about the potency. Okay. I'll just complete one of the questions of the cough and then go to Dr. Aha's case maybe. There was one question also where the patient says that the boy was very dull, the boy was very weak, and we have given him a lot of medicines and still there is no relief with the cough. बॉडी में लाल मस्से हो जाते हैं ओल्ड एज में. या डॉक्टर कुमार, वही मैं आपको बताना चाह रहा हूँ कि आई हैव नेवर क्योर्ड अ केस कि बहुत ज़्यादा लाल मस्से हो अगर पेशेंट ठीक हो गया. आई हैव नॉट क्योर्ड अ केस, सो आई कैन नॉट कमेंट ऑन दैट. As such, you can think about routine medicines like Thuja, nitric acid, Cilicia, Calcarea, Fluor, a lot of medicines. Acid fluoro, you can think. Hello, Dr. Meera, good afternoon. I think your case was arsenic, so you can try arsenic in that case. I was talking about a cough. A patient came to, there was a question where the patient, the doctor told that the boy was very dull, very emaciated, loss of energy, lot of weakness, and he had given a lot of medicines, but there was no cure. In this case, see, the patient is actually trying to tell you symptom through his disease form. You can take cough dry in emaciated boys. That is lycopodium. So whenever the patient is telling you some symptom, try to convert that symptom into a repeated language, or you can convert that symptom into mathematical language, and the remedy becomes easy. So that was lycopodium. So Cough in emaciated boys, you can take weakness, you can take letharginess, you can take lassitude, you can take anything. That's like a lycopodium. And cough from little exertion, that is oxytropis. Or you can ask me other questions, sir. When there is violent exertion, then only cough starts. Then that is not oxytropis. If the patient says that I do gymming exercise, I do lifting exercise, and then I get cough, then it is not oxytropis. Then the remedy changes. So you can think of the remedy. So one case we have. Good afternoon, Dr. Disha. Possible patient, 82 years old male. He has got cirrhosis of liver, non-alcoholic. He was overweight when young. His body is filling with fluid and his kidneys went into failure. Dr. Raha, you must have you will get some symptom in relation to kidney liver failure. You know what? I had a case of liver failure where you must I think you were there on the live or not. The patient with liver failure had a lot of itching in the body, and I gave the patient a single dose of Myrica 200, and that itching was better. Still, the patient is with me and he is much better with cirrhosis also. The body will show some symptoms of cirrhosis in constitution differently, that you have to pick up. Otherwise, constitution which we very obese after cirrhosis normally becomes lean thin because of the accumulation of fluid and indigestion. There has to be some symptom which you are missing in this case. Dr. Sahni, tuberculosis homeopathy से क्योर होगा क्या? One answer to this, Dr. Sahni, homeopathy can cure all curable diseases and have cured diseases which are genetic also. But in tuberculosis, according to government, you have to notify all the cases and they have to take anti-tubercular medicines. So my request would be to send the patient for notification and then see what the government tells you. Okay. In cases of patient who do not respond to anti-tubercular medicine, you can give homeopathy medicine simultaneously and it will definitely help in his treatment. 15 years old having uveitis, patient is reserved, taking a lot of tension during exam. She had always diarrhea along with this uveitis. Uveitis, tension, diarrhea. There are 3-4 medicines that you can think about. First is phosphorus, second is bryonia, third is pulsatile, and the fourth is natramur. Okay. Pins ke tede ho jane after prostate. I did not understand the question, Dr. Kumar. Kidneys were trying to get out and the kidneys went to failure. He also has heart murmur and doctor took him off all the diabetic medicine. Yeah. See, whenever you get kidney failure, automatically the sugar starts coming to normal because there is no insulinase enzyme which kidney produces. So there is a lot of insulin there and that's why the sugar starts going down. It's a sign of kidney failure also. In this case, Dr. Ha, you have to have some symptoms which I told you in German, symptom which defines the patient personality. Whenever a body becomes sick, whenever the vital force is deranged, it has to show some symptoms of sick on the body, either mentally or physically. In this case, if it is damaged, multi-organ failure is there, there has to be some symptom which will define the patient's personality. You have to try to find out that. Sir, kindly tell some medicine for lack of confidence where one thing that something is wrong and happens in future. I think, Nitin, you have to show it to a doctor in your vicinity in Delhi because these questions are repetitive and my answer is not helping you. So you must visit a doctor there. Okay. Because of his blood sugar drop, because he has lost enough weight also, his doctor took him off medication that he's been taking for 40 years and his body reacted and filled with fluid. No. Basically what happens, Dr. Raha, in case where the kidney is failure, the sugar automatically tries to come down because there is no insulinase enzyme which the kidney produces. This insulin enzyme basically has a negative effect where you give insulin medicine and the kidney takes it out. If the kidney does not take out the medicine, then the insulin keeps rising and the patient lands up in low sugar. Because the kidney is not working, that enzyme is absent in that patient and that's why the sugar is coming down. So it is basically the body's mechanism. So you have to find out more symptom to prescribe. I think we had 40 pounds of liquid in him. Okay. Now he has really low energy, feel exhausted, sleeping, having trouble at night. He's sleeping during the day. This message, yeah. So you have to ask some symptoms in the body or in the mind which has changed after the disease process. That is important. Low sugar in kidney failure is normal. Sir, मेरी femur shaft single fracture हुआ थोड़ा. See, whenever there's a fracture, think about symphytum, calcarea 4, If you give me the case symphytum 30 or symphytum LM potency, repetition would be better. हेलो सर, बॉडी स्क्रैच करने पर स्मॉल रेड स्पॉट्स हो जाते हैं 3-4 days. Whenever you scratch the body and there are a lot of reddish, discoloration or reddish, what you call, eruptions, think about epismel, think about bovista, think about pulsatilla, think about ferrum phos. Okay, epismel, we had a beautiful case of, hydrocephalus that I discussed in Germany, and we discussed epismel in detail. Okay, so maybe in this coming, I'll tell you something about epismel more. Sir, would like to know about your German experience about your paper which I presented a paper on potency and how I have made my potency after 5 to 6 years of research, which I'm using in my practice. It's a lengthy topic, so whenever I get a time in webinar or whenever I'm called for a webinar, I'll discuss my potency. So I'm getting good results with that potencies, and I have written a booklet also. If possible, I'll send you, Dr. Meera, so you can distribute there also. Okay. My father 82 years, still now his retinal bleeding continues, sir. His vision day by day decreasing. Hemolysis given. Okay, so if there's a totally spoiled, so see, if there is a little detachment and it is bleeding, you can think about 3-4 remedies which comes to my mind. First is crotalus, second is naphthalinum, third is arnica. You can think about these medicines. At the moment, the only information I have is sleeping a lot and is exhausted and no energy. Okay, so if we have only one symptom, that's sleepiness. And sleepiness can be, because of loss of energy also. And then if you say loss of energy and sleepiness, overpowering, you can think of 3-4 remedies, Dr. Ra. First is Nux mosqueta, second is opium, third is Antium tart, and fourth is Zincum metallicum. Joshi, thank you. I'm coming this time to Bombay on the 27th of April, 1 week before. Like last time I came 1 week before. Because on the 4th I'm busy. Dr. Joshi, I think you are asking a question. Sir, lung, emphysema, homeopathy medicine. There are a lot of medicine for emphysema. You can think about simple, bryonia also, kaliard also, kalicarb also, sternum metallicum also, beryllium met also. Advice helping, kindly sell some medicine, 1% negative. If my advice is helping, then I think I have told you a lot of medicine, Dr. Nitin. You can think a lot of medicine. Simple as that. Anxiety has a lot of medicines. I always tell you there is something to define the patient's personality. Think about Califos, think about Califos, think about arsenic, think about argentum nitricum, think about camphor, think about carbovoids, think about calcareous horse, think about carcinosin, veratrum, lot of medicines. Elements from suppressed diarrhea. Now see, in homeopathy, if you see homeopathy, so this is a very, very important thing in homeopathy. Diarrhea suppressed. It is like cause and effect. Elements from diarrhea suppressed. If you go and see the Mater Medica, if you go to see the repertory, there are lots and lot of medicines. You can write down medicines: Nux vomica, sulfur, Staphylococcus aureus, chamomilla, colocin, calcarea phos, gelsemium. There may be some medicines also, but only I can this type of medicine. Is uterine fibroid curable with hello homeopathy? And sir, how to choose a preferred simlimum? Very simple answer, Dr. Maharia. First of all, I always say that if I have cured, then I can give the answer it is curable. So my answer would be, I have got cases where I have cured fibroid, big fibroids with homeopathy medicines. I have the cases documented before and after treatment also. It is curable. Your second question is how to choose a perfect simillimum. See, choosing perfect simillimum, it's, if you ask me, I'm not telling you don't follow other schools of medicine, but if you ask me, my approach is very simple. Take a case according to what is given in an organ of medicine. Select a simillimum according to the miasm, in your case, a psychosyphilitic miasm. Give the potency, repetition according to the Herring's law of cure, and look for Herring's law of cure. Simple. It is case taking, miasm, minimum repetition, Herring's law of cure. That is what I look in my cases. Sir, tuberculosis patient medicine के लेना चाहे तो sir, Yeah, if the patient wants to take medicine, it is well and good. But if there is a government protocol, why we have to follow? If something goes wrong, if something the patient does not get better, if there is an aggravation, then the patient comes and tell you, why did you tell me? I would have gone to the allopathy doctor. So it is our duty to at least give them advice. It is a notifiable disease, so that's why you have to tell the patient. And then if the patient wants to take treatment with you, you have to take the symptoms, and if you take the symptom, then you have to prescribe the medicines. An aged person feels abnormally feeling in his legs. He cannot sleep due to that feeling, but that part is repeatedly hits by fist and parts become feelingless, then can only sleep. Whatever I could understand your question, Doctor, I think if the patient has, he hits the, I think, extremity, and when there is no feeling, and then the patient becomes better, I think that's what. So you can, this is called as analgesia. The patient hits the part so much, the part becomes numb, that is analgesia, and then he can sleep. There are few remedies you can think about is lycopodium, oleander, cocculus, stramonium, and plumbum. These are the medicines that come to my mind. Sir, one patient taking retroviral treatment facing constipation problem, taking homeopathy and allopathic medicine, still not feeling better, and constipation, going to washroom for 3 to 2 times. See, if the patient is taking an HIV medicine and he is suffering from constipation, your remedy could be right, Sonam. But in this case, it has to be repeated or repeated in LM potency. Because the retroviral medicines are very strong, those are immunocompromised remedies, That's why the repetition is very important in this case. I have seen in many of cases, the remedy is right, but because of repetition, because of potency selection, there's a problem, and we change the remedy and we lose the patient. Repetition and selection of potency in this case is very, very important. Parotitis, stony, hard, left or right side. Stony hardness of gland, left or right side. Think about Mercator rubrum, Mercator flavor, sister scan, calcarea floor, conium, phytoleka, silicia, these medicines. Okay. Nostrils epistaxis, FT nostrils epistaxis from right nostrils frequently in 20-year-old girl. That means you're talking about epistaxis only, nose mein. Epistaxis, I think it is right side, 20-year-old girl. Okay, whatever I understood, it is epistaxis, the right side. Okay, so yeah, you can see there are n number of medicine, Dr. Ali. If I keep on telling you medicine, then the whole webinar, the YouTube will be over. These are the common medicine which I can get. So epistaxis, right side, frequently 20-year-old. There are 3-4 medicines very important, Dr. Joshi. First is Veratramal, second is ammonium carb, third is kali carb, fourth is kali chlor, fifth is bryonia, and sixth is calcarea carb. I am so grateful that you are doing this presentation in English. Thank you, Dr. Alex. But definitely, I will have two, YouTube presentation, as we all discussed there, one in English and one in Hindi. Okay. Today, because when I came in Monday, there was so much rush that I could not finish the OPD. So I'm just coming out of that Germany, that hangover is still there. So I could not write that English and Hindi. So experiencing salivary stones. Salivary stones, see, I have a lot of cases, but don't take that cases as disease per se. Okay, if there is salivary stone, that this medicine, then calcarea floor or XYZ medicine. Symptomatically, and the patient would be cured. Okay. Can Aurum Met 1M cause aggravation in only 2? I think this is a repeated question. My philosophy would be Aurum Met 1M, if it cause aggravation also, don't worry. I have not seen those type of aggravation in 2 or 3 days. If it is homeopathy aggravation, it will subside by its own and the patient would not complain so much. If you feel that is aggravation, there's no need to antidote. I have never antidoted medicine. The next prescription, if it is a similimum, then that's the remedy. Okay. I think I have done that question also before. Okay. So let us go forward. I forgot, there are a lot of questions on cough. So I did only 2, cough in emaciated boys, lycopodium, and cough on slight exertion, that is oxytrophies. My question to you all was, if there is cough on violent exercise, not on slight exercise, then which remedy to give? So you have not answered that question. Sir, what can I give to relieve the pain in supraspinatus tendinitis? No medicine giving relief. See, supraspinous tendinitis, the first thing you have to tell the patient, for rest. It has inflammation, So if the patient keeps working, how will the inflammation subside? First is rest. The patient has to take rest or give rest to that part. And then you can start thinking of medicine. Mostly, the medicines are right. But because the patient is not taking rest, there will be a problem. Or give LM potency repetition. Sir, tuberculin 10 aggravation. First of all, tuberculin 10M I have never prescribed in my life. I've only prescribed 1M in water, so the aggravation is minimum. Okay, sir, how to deal with unipolar disorder? I think this question would be asked better by Dr. Alexandra or Dr. Barbell or Dr. Raha. I think I presented a case of bipolar disorder. I gave the patient cannabis indica. Beautiful case. The patient responded within 24 hours. In psychiatric cases, it is very important to interpret what the patient needs to tell you. Otherwise, in bipolar disorder, whatever symptoms you take, it will be symptoms only of, anger, delusion, and the remedy would be belladonna, stramonium, and hyoscyamus. Understand what the constitution wants to tell you. Even in cases of panicky situation, the body will tell you those symptoms which require the similum. As I've written in my book, truth is the similum. Try to find out the truth. That is very important. Okay. Mohit says, sir, any medicines for goiter? Yes, lot of medicines for goiter. And if you see in books, we have spongia, we have thyroidenum, we have kali iode, we have calcarea floor, we have lot of medicines. For me also, treating or curing goiter is difficult, but I have few cases where I have cured goiter. PCOD की आयुर्वेदिक दवाई, I don't prescribe Ayurvedic medicine, sir, so I cannot answer this. How to prescribe lycopodium for chronic stomach disorder? Very, very easy. Go to the Mater Medica, lycopodium, and see there are a lot of symptoms of lycopodium. First, make sure that you take symptoms of lycopodium which are related to lycopodium. For example, don't prescribe on common symptoms like gases in the abdomen, bloating in the abdomen. You'll never be able to prescribe that. Go, for example, if you are following any Mater Medica, go to stomach. Like for example, lycopodium has excessive hunger. Lycopodium has aversion to bread. Lycopodium has a problem of has loss of appetite, but when he starts eating, he eats too much. So there are a lot of symptoms. There is liver is very sensitive. There are brown spots on the abdomen. Try to go with the unusual symptoms or PQRS symptoms. Which potency save? All potency are saved depending on your case. I start with 30 and 200. Senile depression after viral fever, violent cough. What to tell about this? You have to take the whole case, doctor. If you take the whole case, then only you can have the case. Which potency is best? 30 200. And in mental symptoms, I start with 1M. ट्यूब एग्रावेशन हो जाएगा एग्रावेशन. अगर होम्योपैथी एग्रावेशन है तो देयर इज नो नीड टू चेंज द मेडिसिन, इट विल सबसाइड ऑन इट्स ओन. If you feel the aggravation is there, then you have to again take the case and give the medicine. That would also be the similum and also be the antidote. It was amazing long standing case, even better results and so fast. Yeah, thank you, Dr. Raha. So that was the case of cannabis indica. Okay. Constant cough after long time, small yellow balls, life expectoration, they only relieved. Constant cough after long time. Okay. Means the patient coughs, and the expectoration is scanty and it comes after a lot of coughing. So there are 2-3 remedies which are very, very important. You can write down. First is phosphorus, second is causticum, third is nux vomica, fourth is ferrum metallicum, and fifth which comes to my mind is pulsatilla. Sir जी यूट्राइन फाइब्रोइड के लिए मेडिसिन. First of all, Dr. Mohit, uterine fibroid or any disease, basically if it's a chronic disease, it's very important to take the case and then prescribe the medicine. First, there are some very frequently used medicines for fibroid. For example, Thalaspi bursa pastoris, Felix mas, Felix religiosa, Calcarea flor, um, Thuja, Medorinum. You can look at these medicines, okay? Which potency is best and safe? It depends on the case, doctor. For example, if there is a mind symptom which are very, very prominent, which are very, very, I can start with 1 potency. Apart from this I can start from 30 potency, then go to 200 and then go to 1M. Of late, I am using my potencies, which I have, introduced in homeopathy, which book I have released on 10th April. In coming years or coming months, I'll try to discuss that. First, I'll distribute that book so that you can understand what potencies I'm using. Okay, but 30 to 100 are safe. Case like dyslipidemia, cholesterol is effective or cause medicine. No. In these cases, if you ask me, Dr. Mahera, consultation medicine. Okay, cholesterol is effective. I don't know. I've never used cholesterol in potencies, but lot of doctors say that cholesterol is very good. You can try that and you can tell me that if it works or not. I have never used that. Mind method versus prescribing. See, Dr. Yasin, whatever you prescribe, I have always told, I have told in my Germany seminar also, I take a case, see the miasm, rubricate the case, give minimum dose, and watch for hearing law of cure. Simple. Okay, so it is mind or constitutional or pathological or I don't know, sensation or whatever it is. My case taking and philosophy practice is very, very simple. Okay. Sir, it is almost 1 year being over. Suggestion medicine being over. I did not get the question, Sonam. 1 year, I don't know exactly. Some medicine for what? For constipation. That retroviral case. Okay, so see, whenever you're asking me medicines, in this short 1 or 2 minutes, I can only prescribe what I understand. A homeopathy case taking is a long case taking. It requires hours and requires a lot of, what you call analysis, and then we can come to the remedy. So whatever I can see extempo in whatever you have written, then only I can, supraspinatus. Okay. See, if it is 1 year, the case has become chronic. So of course, case taking important, but supraspinatus muscle. Few remedies that you can think about. Of course, you must have exhausted Ruta or belly spur and Rustox and those medicines. So those are very common medicines. So if the patient is asking you that the disease is since 1 year, that means there is some problem basically in his life. So inflammation, you can think about hypericum, you can think about chamomilla, you can think. I had a case, I had a case of toothache where I prescribed the patient chamomilla 30, took in cotton and applied on the teeth. So you can try that also. Take a potency and apply on the supraspinatus muscle. The local effect would be generalized effect. Yeah, you can do that also. Online consultation, you can take this number and ask my assistant. They'll tell you. Yoibanam cure 30C is better. 30C. Sir, how to deal colloidal cyst? Yeah, colloidal cyst. I had few cases. I still remember the name of the patient also. He had suffering from colloidal cyst and I had cured that case. I was going to show this case in my Germany workshop, but I did not get time. I have a cure of that also, colloid cyst. It was a child, I think, of 13 years of age. He had a colloid cyst and I cured the case with homeopathy medicine. Okay, let's go forward. Some of the questions have been scrolled up. Senile depression after viral fever followed by violent dry cough. Yeah. So depression is a very important symptom. Lot of cases of post-COVID viral we have got in our practice, and you written senile depression, age with violent cough. You can think of few remedies. Phosphorus, fantastic results. Kali carb, sternum metallicum, conium, hipersulf, pulsatilla, arsenic. Hypericum, chamomilla, yes, you can try that. I have told you can try that medicines. It is inflammation, so there has to be some inflammation in the mind Because of this, the muscle has been inflamed. That's the entry point. Start online class of Mater Medica. Yeah, it is very difficult for me to start online, because when you start online, then you have to send the flyers, then you have to take the fees, then you have to start the Zoom, then in Zoom, you have to. So I'm very happy if some others are doing, so that I have to just go and speak. So for me, preparation is very important, and I'm taking webinars every week, 2 or 3. So for me, if somebody takes an initiative, then I can always join and take a webinar. So for me, it's very difficult to understanding, making a flyer, then distributing it, then calling everybody online, then putting a message that come, come, come. It's been difficult. So I'm taking webinars, and so whenever I'm maybe my assistants are in mood, then we can start with the seminar. Okay. You can take that number and you can SMS that SMS 901-303-171. I'll SMS the number to you. This is the same number I'm using it. Yeah, you can join the group. Yeah, but Dr. Alexander, it would be Hindi, English both, and in our group there will be a problem. For that I have to, I think, study German. My clinic, the number of my clinic, I'll tell you. Yeah, you can write the number of clinic 9011-303-171. So you can ask and take the appointment there. Okay. So I think it's already half an hour up, and thank you for joining. After 2 Saturdays, it was 30 C is better, Dr. Nathan. So I hope you enjoyed as much as I enjoy sharing my knowledge with you. Until next Saturday, goodbye.